Welcome to Final BDS Made Easy. In this video, we are going to discuss the one markers from the subject of periodontia. So let's begin. First question is dehiscence. It is defined as the loss of alveolar bone on the facial or less commonly on the lingual side of a tooth that leaves the root surface exposed. When the denuded areas extend through the marginal bone, the defect is called a dehiscence. Number two is principles of instrumentation. These are accessibility, which includes patient and operator positions, visibility, illumination and retraction, condition and sharpness of instruments, maintaining a clean field, instrument stabilization, and instrument activation. Third question is junctional epithelium. It is a stratified squamous non-keratinizing epithelium that forms a collar-like band around the tooth, providing a seal at the base of the gingival sulcus. It extends from the base of the gingival sulcus to the CEJ in health. It acts as a barrier to protect the periodontal tissues from bacterial invasion. It attaches to the tooth surface via hemidesmosomes and the internal basal lamina, and it has a high turnover rate. Question is the radius of action. Locally produced bone resorption factors have to be present in the proximity of bone surface to be able to exert their action. Range of 1.5 millimeters to 2.5 millimeters within bacterial plaque can induce loss of bone. Interproximal angular defects can appear only in spaces that are wider than 2.5 millimeters. Question is intermediate cementum. It is a poorly defined zone near the cemento-dentinal junction, separating cementum from dentine, which does not exhibit characteristic feature of either dentine or cementum. It appears hyaline, that is structureless, and so it's also called the hyaline layer of Hopper-Smith. This layer represents area where Hotwig's epithelial root sheath cells become trapped in a rapidly deposited dentine or cementum matrix, giving rise to an intermediate layer. Usually occurs in the apical half of roots of molars and premolars. Question is mention some names of sharpening stones. These are Arkansas stone, India stone, diamond stone, and the ceramic stone. Next question is peri-implantitis. Peri-implantitis was defined as a plaque-associated pathologic condition occurring in the tissue around dental implants, characterized by inflammation in the peri-implant mucosa and subsequent progressive loss of supporting bone. Next question is repair. Repair describes healing of a wound in response to injury in an attempt to restore the normal structure and function. Question 9 is peri-implantation. Peri-implantation refers to the biological events occurring around a dental implant after its placement. It involves the formation and maintenance of the peri-implant tissues, including the junctional epithelium, connective tissue attachment, and bone. Monitoring peri-implantation health is crucial to prevent complications such as peri-implantitis. Question number 10 is Bana test. The Bana test is practical for chairside usage. It is a test strip which is composed of benzoyl D-L-arginine A, naphthylamide, and detects short chain fatty acids and proteolytic obligate gram-negative anaerobes, which hydrolyze the synthetic trypsin substrate and cause halitosis. It detects especially Treponema denticola, Porphyromonas gingivalis, and Tenerella forsythia that is associated with periodontal disease. By using the Bana test, we can detect not only halitosis but also periodontal risk assessment. Next question is oral physiotherapy and oral prophylaxis. Oral physiotherapy refers to the self-performed oral hygiene measures by the patient, including toothbrushing, flossing, and the use of interdental cleaners to maintain oral health. Oral prophylaxis, on the other hand, refers to the professional cleaning procedures performed by a dentist or dental hygienist to remove plaque, calculus, and stains from the teeth to prevent periodontal disease. The question is cerumal calculus. Cerumal calculus, also known as subgingival calculus, is a form of dental calculus or tartar that forms below the gum line. It is derived from serum components of the GCF. It is typically darker in color due to the presence of blood breakdown products and is more closely associated with periodontal disease. Next question is dentogingival unit. The attachment of the junctional epithelium to the tooth is reinforced by the gingival fibers, which brace the marginal gingiva against the tooth surface. For this reason, the junctional epithelium and the gingival fibers are considered together as the dentogingival unit. Next question is pathologic migration. It refers to tooth displacement that results when the balance among the forces that maintain physiologic tooth position is disturbed by periodontal disease. Next question is gingival fibers. The connective tissue of the marginal gingiva is densely collagenous, containing a prominent system of collagen fiber bundles called the gingival fibers. They consist of type 1 collagen. They are arranged in three groups, that is the gingivodental, circular and transeptal. According to Page et al., they can be arranged into semicircular fibers or transgingival fibers, and according to Linde, they are arranged as dentoperiosteal fibers. Microtopography of soft tissue wall of pocket includes the areas of quiescence, areas of bacterial accumulation, areas of emergence of leukocytes, areas of leukocyte-bacterial interaction, areas of intense epithelial desquamation, areas of ulceration, and areas of hemorrhage. That's it. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and subscribe to my YouTube channel. Stay tuned for more such videos.